The COVID-19 task force sitting in Kampala has implored Ugandans to embrace vaccination and get booster shots for more effective control of the pandemic. In the race against time, the Ministry of Health wants to ensure that the remaining vaccines are consumed before the expiry date.
Then we can say, let us remove the masks when we have reached that level. So the answer to this is continuous sensitization so that our people are mobilized to go and get vaccinated.
Increased vaccination is not only preventing illnesses, but also trying to prevent other variants coming on.
A status report presented in the meeting indicated a marked fall in COVID-19 cases. The meeting also saw the task force discuss other salient issues, such as whether or not to close the COVID-19 testing laboratory at Entebbe International Airport. They have since resolved to close the facility.
Progressively moved away from requiring tests to requiring vaccination certificates. So it doesn't hurt. We can remove the lab. You can remove the lab and you expand the airport.
It is also resolved to increase sensitization and engagement with the population about COVID-19. Minister for Finance, Planning and Economic Development, Matia Kasaija, also advised the businessmen and women on what they need to do to recover from the effects of COVID-19.
The governor is aware that we need national interventions, especially for specific sectors that were impacted by COVID, like education. Think of people with vehicles who are supplying their vehicles, are literally, they've written them off.
For the small businesses, there is money that is in the bank waiting for them. For the medium and the large ones, there is money in Uganda Development Bank and other financial institutions. Farmers, there is a fund for you.
Members of the public have also been urged to continue wearing masks.
As much as possible to keep on your masks, and unless you are, of course, outside, and get boosted.
Because of a sub-variant of the Omicron, the B5, which has a higher transmission, but also it decreases the neutralization of certain of our antibodies.
Dr. Henry Chobe, National Incident Manager for COVID-19 at the Ministry of Health Uganda, says that the government plans to vaccinate children from the age of 12 to 17 during the coming holidays to ensure the country is safe from COVID-19.
And would like the National Task Force to adopt and implement the suggested whole government approach to tackle complacency and vaccine hesitance and in vaccination of children starting 12 to 17 years in the school holidays, which are just a few weeks away. And Madam Chair,
according to the report presented, cases of side effects of COVID-19 vaccination and other claims that the vaccines were brought to control population growth have greatly affected vaccination uptake in the country. The COVID-19 National Task Force will meet next week to plan for the way forward. Hope Nyongereza, CTV, PM Edition.